Welcome back to The Ticker and the Helix. It is Monday, December 29th, 2025. I'm Joe, your resident biotech bear and chart watcher.
And I'm Jane, the eternal optimist and science geek. And Joe, I can't believe we're already closing the book on 2025. It feels like just yesterday we were popping champagne for the CASGEVY approval.
Yeah, well, in this industry, the champagne goes flat pretty fast, Jane. 2025 has been, let's call it a character-building year for the gene editing sector. We've seen commercial rollouts that move at the speed of a sloth, strategic pivots that would make a politician blush, and unfortunately, some very sobering news in the last few weeks that's reminded everyone that rewriting the code of life isn't a video game.
You're referring to the news out of Intellia Therapeutics in November, right? That really shook me.
It shook the whole market, Jane. We'll get to that dark cloud in a bit because it's probably the most significant event of Q4. But we should start with the big dog in the yard, Vertex Pharmaceuticals and CRISPR Therapeutics.
Let's do it. CASGEVY, the first ever CRISPR-based medicine, has been on the market for roughly 2 years now. This treats sickle cell disease and beta thalassemia. How are the numbers looking?
The numbers are fine. Just fine. Look, Wall Street wanted an explosion, but what we got was a slow burn. Vertex raised their full year 2025 revenue guidance to around $12 billion total for the company, and CASGEVY is finally starting to contribute meaningful chunks to that. In the second quarter of this year, CASGEVY pulled in about $30 million. It's not iPhone launch money, but for a complex gene therapy, it's traction.
$30 million doesn't sound like a lot for a cure that costs over $2 million per patient. That's like, what, 15 patients?
Exactly. And that brings us to the logistics bottleneck we've been warning about for years. To understand why the sales aren't vertical, you have to understand the patient journey. Jane, explain to the listeners what a patient actually has to go through to get CASGEVY.
Right. So it's an ex vivo therapy. That means out of the body. It's not a pill you swallow. First, you go to a specialized treatment center. Doctors hook you up to a machine to harvest your stem cells from your blood. That takes days. Then those cells are shipped off to a manufacturing lab, basically a high-tech clean room.
Where the molecular scissors come out.
Yes, scientists use CRISPR-Cas9 to edit the DNA inside those cells. Specifically, they break the gene that turns off fetal hemoglobin. By breaking the off switch, the cells start making fetal hemoglobin again, which compensates for the defective adult hemoglobin in sickle cell patients.
And while those cells are at the spa getting a makeover, what's happening to the patient?
That's the hard part. The patient is in the hospital undergoing myeloablative conditioning, basically high-dose chemotherapy to wipe out their remaining bone marrow. It makes space for the new edited cells to engraft. It's brutal. You lose your hair, your immune system crashes, and there's a risk of infertility.
Precisely. It's like renovating a house. You can't just install the new kitchen while the family is cooking dinner. You have to gut the place first. That gutting process, the chemo conditioning, is a huge barrier. A lot of patients are saying, I want the cure, but I don't want the chemo. That hesitation, combined with the slow process of setting up authorized treatment centers, is why we're seeing tens of millions in revenue, not hundreds of millions yet.
But the data is holding up, right? I saw Vertex release long-term follow-up data this year.
The efficacy is undeniable. Over 95% of sickle cell patients are remaining free of those agonizing vaso-occlusive crises for at least a year. Some are out 5-6 years now and still doing great. It works. The question for 2026 is, can they scale it? And can they find a way to do it without the harsh chemo? Vertex is working on gentler conditioning agents, but that's still in the pipeline.
So CRISPR Therapeutics stock, CRSP, how has it reacted to all this?
It's been a roller coaster. The stock is up about 40% in 2025, which sounds great until you zoom out and see it's still way down from its 2021 highs. It's trading in the mid-50s range. Investors are basically saying, okay, CASGEVY is real, but where's the profit? Remember, Vertex takes 60% of the profits. CRISPR Therapeutics only gets 40%. So CRSP is still burning cash, although they have a healthy balance sheet.
But CRSP isn't just a one-trick pony. They're moving into cardiovascular disease too, right?
And that's the perfect segue to the biggest theme of 2025, the shift from ex vivo to in vivo. The house renovation versus the plumber coming to fix the leak while you're still living there.
I love that analogy. So in vivo means the editing happens inside the body. You get an infusion, the CRISPR tools travel to the right organ, do the snip, and leave. No chemo, no hospital stay, no hair loss.
That's the holy grail. And that's where the drama is right now. CRISPR Therapeutics has a program called CTX310. It targets a gene called ANGPTL3 in the liver. If you knock that gene out, your bad cholesterol and triglycerides plummet.
And the data on that has been exciting.
Very. We saw data recently showing an 80% reduction in triglycerides. That's massive. If they can make a one-time shot that replaces a lifetime of taking statins or other heart meds, that's a multi-billion-dollar drug. But, and it's a huge but,
The but is Intellia.
the but is Intellia. Let's talk about NTLA. For most of 2025, Intellia was the golden child. Their stock was actually outperforming CRISPR Therapeutics for the first half of the year. They have a drug called Nexen, formerly NTLA-2001, for ATTR amyloidosis. It's an in vivo therapy. It uses lipid nanoparticles, basically tiny fat bubbles, to carry the CRISPR instructions straight to the liver.
ATTR is a nasty disease where misfolded proteins build up in your heart and nerves. Intellia's drug stops the liver from making that protein.
Right. And in phase 1 and 2, it looked flawless. Deep reduction of the protein, patients feeling better. They moved into phase 3, the magnitude trial. Investors were practically pre-ordering their yachts.
And then November 6th happened.
November 6th, 2025, Intellia's Q3 earnings call. Usually a boring affair, but they dropped a bombshell. A patient in the phase 3 trial died. And it wasn't just a random event. The patient had grade 4 liver transaminase elevations. That's doctor speak for severe liver injury.
That is terrifying. And since the drug targets the liver specifically, it's hard to argue it wasn't related.
The company said the patient had complicating comorbidities, which is standard biotech damage control. But the FDA didn't blink. They slapped a clinical hold on the trial. Now, we're sitting here in late December, and that cloud is still hanging over them. The stock tanked. It wiped out almost all the gains from earlier in the year.
So what does this mean for in vivo gene editing? Is it too dangerous?
It's a reality check. When you do ex vivo, outside the body, you can quality check the cells before you put them back in the patient. If the edit went wrong, you throw the batch away. But with in vivo, once you inject that lipid nanoparticle, there is no undo button. If the immune system freaks out, or if the CRISPR cuts the wrong thing, or if the liver just can't handle the load, you're in trouble. This death at Intellia has forced the whole sector to hold its breath. It's reminding everyone that the liver isn't just a passive sponge for these drugs.
It's tragic for the patient and their family. But does this affect other companies, like Editas?
Great question. Let's look at Editas Medicine, Edit. They've had a fascinating 2025. Remember, back in late 2024, a year ago, they made a huge strategic decision. They completely killed their sickle cell program.
I remember people were confused because they were technically in the race with Vertex.
They were in the race, but they were running in third place with a limp. Vertex and Bluebird Bio were already approved. Editas looked at the market, saw how hard the logistics were, like we discussed with CASGEVY, and realized they'd never make money. So they folded their hand. They stopped the Ren Cell program to save cash.
So where did they pivot to?
They went all in on in vivo, specifically a program called Edit 401. And guess what it targets?
Don't tell me, cholesterol?
LDL cholesterol, but a different pathway than CRISPR Therapeutics. But yes, heart disease. In September 2025, just a few months ago, they officially nominated Edit 401 as their lead candidate. They presented data showing greater than 90% reduction of LDL in monkeys. That's better than Lipitor. That's better than the PCSK9 inhibitors on the market.
But if Intellia is having liver safety issues, won't Editas have the same problem? They use lipid nanoparticles too.
That is the multi-million-dollar question. Editas claims their delivery system is different, more targeted. But until they get into humans, which they plan to do with an IND filing by mid-2026, it's all theoretical. The market is skeptical. Editas has TASH to survive until 2027, but they are essentially a show-me story now. They have no commercial product. They are pure R&D again.
Okay, so we have the first-gen CRISPR guys, Vertex and CRISPR-TX, struggling with logistics. We have Intellia struggling with safety. Who is bringing something new to the table? What about Beam?
Beam Therapeutics, the pencil to CRISPR's scissors. For the listeners, standard CRISPR-Cas9 cuts the DNA strand in half, like cutting a ribbon. The cell then clumsily tries to tape it back together, and that scarring disables the gene. That's how CASGEVY works.
And Beam's technology, base editing, doesn't cut the ribbon.
Right. It lands on the DNA and chemically changes one letter to another, an A to a G or a C to a T. It's much more elegant, less risk of those chaotic double-strand breaks that can lead to weird mutations.
So, how is Beam's 2025?
Quietly productive. They are also chasing sickle cell with a drug called Beam 101. By mid-2025, they had enrolled over 40 patients and dosed about 30. The data looks clean, but here's the problem. They are late. CASGEVY is already approved. Can Beam capture market share just by being slightly better or safer years later?
Well, if they can show it's safer, maybe. But if CASGEVY works for 95% of people, that's a high bar.
Exactly. That's why analysts have a hold rating on Beam. The tech is cool, but the commercial path is crowded. However, they have a liver program for alpha-1 antitrypsin deficiency, AATD, called Beam 302. That's a disease with no good cure. They expect data in early 2026. If base editing works in the liver safely, without killing patients like we saw with Intellia's platform, Beam could suddenly become the leader.
It seems like everything comes back to the liver. It's the gatekeeper.
It is. The liver is the easiest organ to hit with these lipid nanoparticles because it naturally filters the blood. If you can't make it work in the liver, you can't make it work anywhere.
I want to zoom out a bit. We've talked about the big players. What about the tech itself? Are we seeing any improvements that could fix these safety issues? I've been reading about AI integration.
Yes, CRISPR-GPT and other AI models are the buzzwords of late 2025. Basically, scientists are using AI to predict off-target effects. Before you inject a patient, you run a simulation. The AI scans the patient's entire genome and says, hey, if you aim for this gene, there's a 0.01% chance you'll accidentally cut this other gene over here that prevents cancer. That level of prediction is getting much better. It helps companies design safer guide RNAs.
That's incredible. It's like spell check for gene editing before you hit print.
It is. But as Intellia showed us, prediction isn't reality. The AI didn't predict that patient's liver failure. Biology is messy. The immune system is unpredictable. We are still in the Wild West phase, Jane. The pioneers have arrows in their backs.
Let's talk money. We have listeners who are investors. If you had to summarize the investment landscape right now on December 29th, 2025, what is it?
Okay, here is the harsh truth. The easy money in CRISPR was made in 2020 and 2021 on the hype. Now we are in the execution phase, and execution is boring, expensive, and risky. Vertex is your safe harbor. They have the cystic fibrosis monopoly printing cash, and CASGEVY is just a nice bonus. They are huge, profitable, and stable. CRISPR Therapeutics, CRSP, is the volatile middle child. They have a product on the market, which is huge, but they aren't profitable yet. If CTX-3110 for cholesterol works, they could double. If it fails, they could drift lower. Intellia is currently in the penalty box. Until the FDA lifts that clinical hold and they explain the patient death, the stock is dead money. It's a high-risk gamble. If the death was a fluke, the stock is a bargain. If it's a platform flaw, it's a trap.
And Editus and Beam?
Editus is a lottery ticket. They reset the clock. Come back in 2027. Beam is the wait and see. If you believe base editing is the future, you own Beam, but be prepared to wait for the data.
It sounds like patience is the keyword for 2026.
Patience and a strong stomach. We are rewriting human DNA, Jane. It was never going to be a straight line up and to the right. 2025 proved that. The science is moving forward. The fact that we can lower cholesterol by 90% in monkeys with a single shot is a miracle. But translating that to a safe, approved, reimbursed product for humans, that is the grind.
Well, despite the setbacks, I'm still optimistic. We have cures for sickle cell that didn't exist 3 years ago. That counts for something.
It counts for a lot. Just ask those 95% of patients who are pain-free this year. That's the real ROI. But for the ticker tape watchers, 2026 is going to be a year of show me the safety data.
We'll be here to cover it all. Happy New Year, Joe.
Happy New Year, Jane. And to our listeners, trade smart, stay skeptical, and keep your eye on the helix.